Welcome to World Health+SocialGood in Geneva, Switzerland at the World Health Assembly. This week, more than 3,300 delegates from nearly 194 countries are coming together to talk about the most important things in public health. Until now, if you wanted a taste of the World Health Assembly, you had to come to Geneva in May. But today, for the first time, we're bringing you the highlights of it live from Global Health+SocialGood. My name is Cathy Calvin. I'm the Director of Communications at the World Health Organization, and I'll be your host today and the rest of this week. And we're set up here in the heart of the UN Palais, where we can grab the important people as they come by, and you can ask them the questions you want to ask. Let's start straight away with two of the most important people. We have Cathy Calvin, who is the President and the CEO of the United Nations Foundation, and Dr. Gaudenz Silberschmidt, who is a Senior Advisor to the Director General at the World Health Organization. Cathy, let me start with you. As the head of the UN Foundation, you're involved in many different aspects of development, not just health issues. The fact that you're here and that you're actually really trying to help us get the messages out from the World Health Assembly tells me that you think that health is really a vital piece of development. Can you talk about that?
Well, sure. And Christy, thank you, and thank you, Gaudenz, for including us in having this opportunity to let people hear about the issues that get decided here and then affect us all the rest of the year in everybody's lives. I mean, it's been exciting today to hear about polio, which we're almost to the end of, but also adolescent health and newborn health, the importance of frontline health workers. These issues affect everyone, and we know that the health issues of the future, whether they're of poverty diseases or those non-communicable diseases that affect all of us, they're going to be discussed here and they'll have an impact on us. So for us, bringing the voice of the people into these halls and letting them hear what's happening, letting them ask the questions, as you said, is what we like to do. We're using technology then to share the word. And thank you so much.
Super. No, thank you for joining us. And I'm just curious, from where you sit, what are some of the issues that you're going to be watching closest this week?
Well, we know that at the root of all development is health. And Margaret Chan today led us off by talking about how important it is to end polio, but also to look ahead toward the universality of health coverage for everyone. Regardless of your station in life, regardless of where you live, everyone deserves to have health. If you have health, you have the opportunity to make a better life. We know that's critical.
You really do see those benefits in other areas, don't you?
We do. And you know, we've been talking about maternal health and children's health so much already since we've been here, but we know we've got to invest there first so that we can let people have a good life.
Absolutely. Gaudenz, let me come to you for just a minute. You really come to this from such a unique place. Not that long ago, you were on the other side. You were one of the delegates that was here representing Switzerland, and you were in the negotiations for Switzerland. Now you're a senior advisor to the Director General at WHO. Maybe you could give us a little peek behind the curtain and tell us what's going on in some of these sessions and exactly what's going on behind the scenes.
Thank you, Christy, and thank you for bringing the Health Assembly to the people. When I was walking in this morning, I was thinking it's my 12th Health Assembly, 10 times a Swiss delegate, and now the second time on the other side of the Secretariat. And it's really complex and sometimes a little bit chaotic how that thing is going. So let me try to explain what's going on with that 3,300 delegates around here. Just behind us, as we speak, a few minutes ago, the Director General has given her main speech in the plenary. And the plenary is really the most formal one. 100 ministers were listening to her, and they are now delivering their own speeches from their country perspective and from their perspective what should go on the global stage. But the plenary is only the most formal one. The real work of negotiation goes on in another building over there, where the committees A and B are meeting. Committee A just opened, where I come from now. They have to get through about 65 agenda items. We from the Secretariat had to produce about 1,000 pages of documentation. Certainly too much, but agreeing on what should not be there from 194 member states is a real challenge. All of that is translated the paper, and when people intervene, in 6 UN languages. So a very complex and sometimes very formal. In the committees over there is a debate. Some of these agenda items were just noted. Some need a decision or even a resolution to approve them. So it needs sometimes very heated debate. Very often it's not enough just to have the formal committees. Then the committee, as it has just done on violence against women, are creating drafting groups where only the member states get together to negotiate the text of a resolution. There again in 6 languages. But the most important is actually what's going out here in the coffee breaks, in the informal exchange between people. And there you have a mixture of exchanging on what is on the agenda and on exchanging what's going on in the hundreds of side events which are going on in parallel. So even for us, it's really a challenge to manage, and it's really a challenge to get to a consensus of 194 member states.
It makes some very long days for a lot of delegates here, but it seems a little bit complicated and maybe chaotic to some people out there. I'm wondering if you can now translate what happens here into real life. Tell us about something that you've negotiated, for example, that you spent the time negotiating here and now you see it in practice in real life and the difference it's making. Does something come to mind?
When I started 12 years ago in the Swiss Ministry of Health, it was 3 weeks after the start of the SARS outbreak. SARS in Hong Kong came up, and 2 months later we were in the Health Assembly. Huge uncertainty. WHO had to give travel advice but didn't know what's the legal basis for it. So that year's Health Assembly gave a mandate for an intergovernmental working group to negotiate a revision to what is called the International Health Regulation. Just imagine the International Health Regulation before was just 3 diseases: yellow fever, plague, cholera. Hardly anybody knew about it. 3.5 full weeks of negotiation 2 years later, we approved a comprehensive treaty binding 196 state parties into a control of international health emergencies. And during that negotiations, I was led in good Swiss tradition to do actual shuttle diplomacy between 2 countries who have no diplomatic relations, US and Iran, to find a compromise between them on one of the issues under negotiation. Then it came to the last night, Friday night before the Health Assembly. We were in session until 5 a.m. Saturday morning. And only at 5 a.m. Saturday morning we agreed on the text of the health regulation. You think it's done? It came to the Health Assembly. People asked me to chair that drafting group which was created, another 15 hours of negotiation to get a text. One can say quite a huge effort, count one. But if you look now, and you know as well as I know what the health regulation now means, countries are increasing their capacities in airport, in ports, in laboratory to have better surveillance. We as WHO have a legal basis when we give advice, and the Director General just repeated her announcement of having declared a public health emergency of international concern concerning polio. So you can see 10 years ago negotiations changing what each and every of the 194 member countries of WHO are doing.
Perfect example. International health regulations, something that we actually are working with quite on a regular basis now, with MERS, with polio, with several other things. Thank you very much for your time, Gaudens, and thank you for the work that you've done in the past on the international health regulations. Cathy, let me ask you just one more question before I let both of you go. What we're looking for here is to connect to real people, and by real people I mean people who are not in one of these delegations, but who are actually the people who will be using the policies that are put in place on a day-to-day basis. You touched on it just a moment ago, but I'd like you to elaborate for just a second. Why is it so important that the real people, the people who are watching us online right now, are engaged in these discussions?
Well, you know what? The UN Foundation thinks that that's what we do. We help connect people, ideas, resources to the UN. So we try to think about a 14-year-old girl. And I bet everybody here is thinking about that 14-year-old girl. We had to vaccinate her. We had to make sure she got the health care she needed to stay in school. We need to make sure she gets to choose when and how to have a family. And we need to make sure that she can take care of her family. So everything that's being discussed here will affect that girl, whether she lives in the United States or in Botswana. That's what everybody here is thinking about, and I hope people learn that by watching this program.
Perfect.
Thank
you.
you.
You both so much for coming by. I know Committee A has just started. I'll let you go so you can get your chairs and get engaged in some of the action, but I thank you both very much, and feel free to come back.
Here. This is wonderful.
Super, very good. So there you go. Now you have a little idea about what's going to be happening here over the week. It lasts through Saturday. What's going to be happening and why it matters to you. Now every week or every day this week at this time, we're going to have a visit from Sari Setyayogi. Now Sari Setyayogi may not be a face that you know, but you'll know her work. If you follow us on Twitter at all, she is often the person behind our Twitter account who's giving you the health information from WHO. I've asked her to swing by a little bit this week just so she can tell us what we're talking about on Twitter and that she can tell us what people are engaging on as well. Sorry, thank you for joining us. I want you to start off just in the big picture for a second and tell us how your team will be engaging on the different social media platforms.
Yeah, thank you, Kirsty. There are several places where we cover the World Health Assembly this year. First, there's Twitter, where we do resolutions, decisions that are made during World Health Assembly, and also speeches and technical briefings. But during World Health Assembly, there are a lot of other things that happen that are not speeches, technical briefings, resolutions or decisions. And we cover this on Facebook, on Google+, on Instagram, where we can show people photos of what is actually happening behind World Health Assembly, people action that actually bring this assembly together.
The Instagrams are my favorite because there you have a lot of things that people don't see about behind the scenes. It's very worthwhile. You know, I know we're just getting started here today, but you've already been out there talking on Twitter today. What are you talking to, what kind of information are you putting out from today? I guess we had the Director General's speech and what she was talking about. You live tweeted that, I'm assuming. What
absolutely.
have you been putting out and what are people talking about?
Yeah, today we started by letting people know that the assembly has started and then where they can find the information, the documents, the list of participants. We also tweeted from the technical briefing at lunchtime today about global health security and international health regulations. That was also popular. But aside from what we are saying, we also noticed that people actually enjoy our laser carved apple.
It says about it on social media.
There are a lot of, it is popular. There are a lot of people actually posting this laser carved apple. It says World Health Organization Health System with a link to our website. And it's Swiss made, rest assured. Yeah, you will find this picture circulating on Twitter. But I think the biggest today is DG's speech. Took place every year during the opening day at the assembly, and today it took place at 2:30 today, and that was the biggest today. Yeah.
Now, at the assembly, as you just mentioned, there's going to be nearly 20 resolutions and decisions to be taken. For the people that want to keep up to date of what's going on as it happens here, I'm assuming the best place they can do that is on our Twitter account, is that right?
That's correct.
Okay, that's where we'll be keeping those decisions done. Before I let you go today, can you just let everybody know how they should be following us on the different platforms, what our hashtags are, things like this?
Yeah. On Twitter, you can follow us on twitter.com @WHO, and the hashtag is hashtag WHA67, and for Facebook is facebook.com/WHO. On Instagram, we are at World Health Organization.
Thank you so much, Sari. We look forward to seeing you tomorrow. If you just mind swinging by at about the same time tomorrow,
of course.
We can get the latest.
Thank you, Christy. See you tomorrow.
Thank you, Sari. Appreciate it. So there you go. Sari Setyayogi and her team will be following the World Health Assembly on our social media platforms, so you can get the latest information that you need there. And she'll come by every day about this time to give us the latest information. Now, there's another thing that's happening every day here at the World Health Assembly, and that is what we call technical briefings. Now, technical briefings give us a time where we can dive deep on a particular topic. It's a topic that will be discussed throughout the assembly in one of the different committees or in one of the different working groups. But we want to go deeper on certain topics that need to really flesh out some of the meat to them. And we do those over the lunchtime in a technical briefing. It goes from 12:30 to 2 every day. Today we had our first one of these. It was on global health security. Now I know for the non-health expert, global health security can sound a little bit like jargon. And so I am going to turn to the person on this panel that has just sat down here that I know the best and ask him how he would explain what global health security is. And that's going to be Dr. Keiji Fukuda, who is one of our Assistant Director Generals here at WHO. Keiji, in 10 seconds or less, before I get to your panel, can you tell me what global health security is?
Sure. Christy, global health security basically means that, we face these outbreaks and dangers which can harm people and which can cross borders, and if they're big enough, they can affect the entire world. And because of that, what we do is try to address it by also making solutions cross borders. That's basically health security in the modern world.
All right, so it takes the collaboration, a multi-country collaboration in order to address this and protect the health of people.
Definitely.
All right, super. All right, so disease outbreaks are one of the ones that we hear the most about lately, I guess, where we've been dealing with the international health regulations lately with MERS, with polio and things like this. So that's probably how people are most aware of this right now, and it could have a serious health impact. This is something that all of this panel that is with me keeps an eye on a regular basis. Let me just introduce them to you and then we'll dive into conversation with them. You just met Dr. Keiji Fukuda. He is one of our Assistant Director Generals. He is in charge of the work we do on global health security. I also have Dr. Scott Dow, Director of the Division of Global Disease Detection and Emergency Response at the CDC. Thank you for joining us, sir. And Professor Benoit Vallée, Director General for Health at the French Ministry of Social Affairs and Health, right? Thank you very much for joining us. Keiji, start us off here if you would. Gaudenz Schilberschmidt was just here a moment ago and he was talking about how at this, not this health assembly, but at a health assembly like this, back in 2005, there were the original agreements to the updated, the revised international health regulations after SARS, I guess, and talking about how that grew from here into now something we deal with on a regular basis. What do they do? Can you just kind of walk me through some of the things, just bullet it for me if you would, some of the things that the international health regulations do or enable that protects health globally?
Sure. Well, Christy, to go straight to the point about what we do when we face these kind of dangers and how the IHR help us, is that when there's certain things which are important for countries. They need to be aware that there's dangers out there. They need to be able to detect them when they happen. So this means that they have to have well-trained health professionals. They need to have laboratories. When events happen, they have to be able to respond to them and then communicate that something's going on to other countries, both so those countries can be prepared, but also so the international community can provide assistance which is needed. And then countries also have to be able to communicate to people, basically let them know what's going on, what are the risks, and so people can also not get overly scared by what's going on and also know what to do. So these are basic capacities.
And specifically, what is it that WHO does to help countries get these kinds of capacities?
Okay, well, it's pretty straightforward. If you think of the international health regulations and how we help countries, in part they're a little bit like a playbook. They tell everybody what to do. They're kind of a recipe, so everyone knows what their roles are. The second thing that they do is that they help everyone to talk with each other. They can communicate, they can understand what's going on. And then the third part is that when there's an actual emergency, they help WHO work with everybody to coordinate so that we're all moving in the same direction. When it's peacetime, when there's not a big emergency going on, we work with countries to help them develop those capacities. That's what the IHR brings.
Super, thank you. Let's talk about how this works in real life. I believe it was May 7th last year, right before the assembly last year, when France announced their first case of the Middle East Respiratory Syndrome. This is what we call MERS. It's a viral respiratory illness that many people are still watching it closely, I think, in other areas of the world right now. But that case was announced very proactively. It was really a translation of what you say is the playbook into real life. Could you tell me a little bit about the thinking that was going on in France at the time and why you did what you did?
Yes, thank you for this question. I was in charge of the hospital in Lille, north of France, when this occurred. So I was really in the center of the problem, just arriving from China at that time. And with the Ministry of Health, she came into Lille in order to see how to organize what exactly Keiji presented as the protection first in the hospital, because it's very important to understand that when a case is in an hospital, it can contribute to several other cases, and also to make protection or to put protection in the airports, for example, or in the ports. And so all of this has been organized, and the central point for that is called the focal point, the national focal point. And this focal point, national focal point, sends message into Europe or to the WHO organization. So it's a cascade of events that contribute to secure the situation, local, national, international, in order to first prevent the dissemination, and second, to give some insurance to the public that things are in order and that are taken care of. And I think this is very important. So there is a part of communication with it which is very important.
And it was really the part that I think the public saw very quickly. You were out there very quickly with the press conference. People who were coming through the airports were receiving brochures. I'm curious on a broader picture, the thinking behind the scenes, because I think some people or some countries might say, if we talk about it too much, people won't come. Well, obviously France is a major tourist destination, but that didn't
Fortunately
concern you,
it is.
did it? That didn't concern you so much. I mean, for you, it was more about reassuring the public that you had your eye on this and that this is what people could do to protect themselves. Can you reconcile that, the thinking behind the scenes on that for me?
Yeah, I think it's not contradictory at all. You can just prevent the organization of the entrance in the countries without blocking them. Just be sure that people who arrive are in a good health condition and that they cannot contribute to a massive disorder. We have Ebola recently, and with my minister we've been to Charles de Gaulle, the airport in Paris, and just to show that everything was organized in case somebody would arrive from the country, Guinea in that context, with some of the symptoms, maybe not the sickness, but the symptoms, and you can just take care of them and prevent that something which is both an health crisis, but also I would say a communication crisis would occur. So you have to be there and to show that you organize things and to demonstrate that this is true, because it's more important to demonstrate that you take care of things than just to say that you take care of things.
Thank you so much. An excellent example of how the international health regulations translates into real life to protect people. Professor, thank you so much for coming by. One last person I want to talk to just before we go is Dr. Dao from the CDC. You see, the international health regulations are not just a WHO tool. In order for them to succeed and do their job, it really involves the cooperation and the collaboration of many different countries. And the United States is one of the best partners, I think, that we have working to help countries get where they need to get, have the skills and the expertise that they need to be able to do what France just did recently. Really, the United States is one of our best partners, I think, for this. And earlier this year, you renewed your commitment to this with the Global Health Security Agenda. Can you talk to me for just a second about what this agenda is and how it works?
I'd be glad to. Nothing is more important to us than the full implementation of the international health regulations. And we were very pleased when WHO came out with these regulations and revised them, because they provide a critical framework for the responses to just these kinds of problems, whether it's SARS or Ebola or the Middle East coronavirus. But unfortunately, progress has been slow. It's been slower than all of us would like in terms of implementation of the international health regulations. And so this Global Health Security Agenda is an effort by the US working with other member states to elevate the responsibility for the international health regulations and to accelerate progress towards IHR implementation. In February, our Secretary of Health, Kathleen Sebelius, launched, along with Director General Chan, launched the Global Health Security Agenda as a way to call on other countries to participate in this. And we had a meeting hosted by Finland a couple of weeks ago to further develop commitments towards implementation of the international health regulations and acceleration of progress towards global health security. And so far we've been pleased by the response. On the US side, we have committed to working with at least 30 countries over the next 5 years to meet some certain specific milestones that they will accomplish. And we've called on other countries to join us, other wealthy countries, other countries to join us in accelerating progress towards full IHR implementation. So we think it's a very important issue. And we've been pleased just in the first day or so of the World Health Assembly at the response from individual countries towards this agenda.
I imagine there's quite a bit of hunger for it, and the CDC is very engaged globally. I think broadly, far outside of this agenda even, especially when it comes to disease outbreaks and trying to help countries get what they need, where they need. Can you talk, and can I pry a little bit more about some of the specifics that you'll be doing with this project? How are you going to build these networks and really help get these expertises in place?
Well, the needs are fairly straightforward. As was highlighted with the Ebola outbreak in West Africa, it was detected too late. The response was not as effective as we wanted to. And so this is just one more example of how we can do better. The Global Health Security Agenda aims to prevent epidemics where they're preventable through things like vaccination against epidemic-prone diseases and slowing of the spread of antimicrobial resistance. It aims to detect these problems as early as possible through things like nationwide laboratory systems that can do good quality laboratory testing on specimens from outbreaks in 80% of districts around the country. And it aims to help countries to respond more effectively by helping them to build emergency operations centers that can send teams to all parts of the country and stand up within 2 hours of a public health crisis. So these are some of the basic elements of global health security and of the international health regulations, that we know what needs to be done, but we all need to come together and to accelerate progress toward these things.
Terrific. Thank you so much for that global perspective too on how this all comes together. Before I let you go, I just wanted to ask you one thing to sum it up for me very quickly from a national perspective. From a national perspective, why are the international health regulations so important?
From our perspective in the US, we can't do the job that we need to do to protect American citizens against threats from around the world simply by working in the US. We must work with other countries. We must collaborate with other WHO member states to build capacities everywhere, because a weakness in detection, prevention, and response in any one member state makes all of us more vulnerable.
Super. Thank you so much, Dr. Dow, Dr. Fukuda, Professor Vele. Thank you very much for your time. I'll let you get back to your work, and feel free to come by later in the week as the discussions continue on the different areas. International health regulations will be discussed a little bit later in the week in Committee A, but already today Committee A has opened, and one of the things on the agenda that they will hopefully finish before the end of this evening is immunizations. Immunization is clearly one of the most important tools of public health. Every year, 2 to 3 million deaths are averted because of immunization. Much of this work is done under a program called EPI, or the Expanded Program on Immunization. This week it's celebrating, or this year it's celebrating 40 years of progress. And I have Dr. Rudy Eggers, the team leader for Immunization Services Strengthening at WHO, joining me to talk about this. In public health, this is a very big deal for us. Rudy, thank you for joining us. Tell me a little bit about the EPI. We usually don't like to use acronyms here, but we really do a lot with this because it's so well known in public health. It's the Expanded Program on Immunization. What is it and how does it work?
Right, well, the EPI program, the Expanded Program on Immunization, is there to reach all children of the world with vaccines that are available. When we started 40 years ago, it was just 6 diseases that were targeted with 4 vaccines, and only 5% of the children were actually reached at that point. Now we are in a situation that's much better. We've got 83% of children of the world that are reached. We've got almost a dozen vaccines that are available and that we can use to have an impact on the health of children.
And how has that worked? I mean, that's an enormous success in really a bit of a short period of time. How did you get there? How easy was it to get these vaccinations out?
Well, it's of course the country programs that made it work. So a lot of effort was put in countries, decisions were made to introduce new vaccines. But from the start, the point was this is a program that reaches healthy children. So you needed to build trust and make sure that mothers and caregivers feel comfortable with bringing their children to the program. And of course, people know very well that these diseases that we prevent are killers, cause huge numbers of deaths. And as you pointed out, 2 to 3 million deaths averted are quite a number. We do have a situation where not all children are, of course, reached, and that is still quite a big task ahead to actually go to the furthest child born wherever he or she may be.
I imagine you see certain trends as this grows in the different countries. I imagine you see certain trends and patterns that kind of repeat themselves. Do there tend to be consistent challenges in expanding immunization programs?
Yes, that is true, of course. Countries are in some ways quite unique. They have their own problems, but in many ways there are trends, as you point out, in the kinds of problems they face. Basically, we've learned that you need good data, research or monitoring data. You need a strong leadership in the program and also the political leadership, and that's why the World Health Assembly is so important. And you need really ambitious people that want to get the job done. One of the successes in the 40 years has been the eradication of smallpox, of course, which is a program that was successful because of vaccines. And now that we have polio eradication certified in the Southeast Asia region, we've got 80% of the children of the world living in countries that are polio free. So yes, quite successful and quite different from country to country.
We're going to talk about polio in the next panel that we have coming up, but how many vaccines do you use in this program today, and what are some of the newer ones?
Well, it's quite variable, of course, country by country. So countries make individual decisions on which vaccines they would like to use. Of course, the WHO recommendations on the universal vaccination. It's about a dozen vaccines that are generally available for country use, but countries make their individual decision depending on the epidemiology that they face. What are the newer vaccines? Well, there are the new vaccines around child health, especially the new vaccine for against pneumococcal disease. So that's a disease that causes lung infection and meningitis. And there's a rotavirus vaccine that prevents severe diarrhea. The other vaccines that we're very excited about are vaccines that start preventing cancers. Of course, that's quite new for us. So hepatitis B vaccine and human papilloma vaccines are vaccines that prevent very common cancers like liver cancer and cervical cancer in women. So we're very excited about that. That's really a new step for us to take it into the anti-cancer world.
What is the process of getting new vaccines added into this program?
Well, of course, the manufacturers go through the development of the vaccine and make them available to us. In recent times, actually, there's been quite a good interaction between the public sector and the private sector. I think the greatest example is the MenAfriVac vaccine, which is a vaccine that was especially designed for the developing market. Normally, vaccines, of course, first appear in the developed countries where the affordability is, of course, better. But this vaccine now was designed specifically for this situation and is actually a great vaccine because it also can take higher temperatures. Some of the other vaccines that we have are actually quite sensitive to temperature, and this vaccine has been specifically designed to also operate in high temperature climates, which is great for Africa where it has to be operating. So great interaction with the public and private sector to actually take these vaccines forward.
Well, we actually just got a question from some of our viewers online, and they're asking, what is the future for public-private partnerships? Where is the greatest value being created? Do you want to add anything to flesh that out a little bit more from what you just said?
Well, we've of course been very happy to be part of the Global Alliance for Vaccine and Immunization, which is an alliance of public-private partnership that brings together interested parties on immunization. And that's been extremely successful in actually rolling out new vaccines, in increasing coverage, and has really brought together the key players. And whereas previously it was focused on the public sector only, in Gavi, of course, there's a strong emphasis also to make sure that the private sector and the vaccine industry specifically is also included. And I think that has galvanized really the situation, the market, the vaccine market, and also the program. We've been able to do so much more with the funding that has been provided and the partnership that's behind it.
You know, you just touched on some of the innovative approaches that we're using now to be able to close that immunization gap. One of the ones I just wanted to call attention to was the idea of creating vaccines that actually don't need to be in a cold environment. That's got to be quite an effective tool.
Yes, that's actually quite wonderful, because there's of course a great limitation. If you have to keep the vaccine cold throughout its life, it means that you have to have a fridge right to the lowest level of the services, and unless you have that, you can't really reach the people. And if you've got vaccines that don't need to be kept cold, then that's wonderful. You can take it out into the field much further.
Rudy, thank you so much for coming by. Congratulations on all the work and the success that you've got so far with EPI, and we'll let you get back to the World Health Assembly, but thank you very much.
Thank you so much.
Now, in addition to Committee A and the technical briefings going on right now in Geneva around this event is about 8 to 10 side events every day. So the town is full to the brim, you have to understand. And if you have any interest in any public health area, you can find an event that works for you, that you can learn more about and spend time with the experts who are engaged in the same topic. One of the ones that we'll see Wednesday night is going to be the celebration for EPI at 40. So it's a very big week with this many people engaged in the success of immunization. There's a lot of passion in town for the 40 years of EPI. Now, our final panel today combines the three main topics that we've actually been talking about. We're going to start with the translation of how actions here at the World Health Assembly improve health for real people. We talk about the international health regulations and how that steps in to protect global health, and the difference that a good immunization program can make. Our last panel is on polio eradication, and joining me is Dr. Alan Brooks from the Gavi Alliance, thank you very much, and Dr. Bruce Allwood, the Assistant Director General here at WHO, who's in charge of polio eradication. Thank you very much. Bruce, correct me if I'm wrong on this, but it was at the World Health Assembly in 1988, just like this, were these countries committed to eradicate polio. Is that right? Do I have that right?
Yeah, absolutely. It was just nearly 20 years ago now, over, that the world's ministers of health got together here at the World Health Assembly and launched what was probably one of the most ambitious health initiatives ever, to try and reach every child everywhere in the world and eradicate one of the most devastating, deadly diseases forever. A very, very ambitious goal.
And how's that going?
Really well. Actually, just today at today's World Health Assembly, the Director General of WHO started her speech to the Assembly, reporting that she had declared the international spread of polio now a public health emergency of international concern, invoking the power of the international health regulations to help ensure we protect the progress that's been made and get the job finished. So today, there are 10 countries that are infected with polio over the last 6 months, but most of those have 1 or 2 cases. That's it. In Nigeria, 3 cases of polio this year. In Afghanistan, a few cases. The exception is Pakistan. Big outbreak, 66 cases, most of it though in one area of that country. And when we started, Christy, way back in 1988, there were 3 types of polio paralyzing kids. Today, there's probably only 1, which means we're closer than ever, and the world is making the stakes of finishing even higher by invoking the international health regulations, as the Director General said just a couple of hours ago here at the Assembly.
Well, we're really trying to connect what's going on here in the halls and in the rooms here, and how it translates to real life. And a few weeks ago, whenever it was polio was declared a public health emergency of international concern, there was a nuance there that was important, wasn't there? That low season transmission. Talk about what was different about that and why somebody like you, who knows polio inside and out, it was a red flag for you, wasn't it?
Well, first let's talk about what you mentioned at the beginning, what happens here at the Assembly on something like polio. This is one of those rare times when we've got the ministers from around the world, we've got health delegations from around the world, and when you're trying to do something as ambitious and extraordinary as eradicate a disease forever, it requires tremendous collective action. And this environment, the World Health Assembly, brings together all the key players who can make collective decisions very, very quickly to help move it forward. Now, what happened over the last couple of months during what we call the low season for polio, the alarming thing that happened was, although there's very little polio in the world, we saw it spread in the Middle East, from Syria into Iraq. We saw it spread in Central Africa, from Cameroon and Equatorial Guinea, and especially from Pakistan into Afghanistan. And when you see 3 areas of the world where there's international spread in the low season, the concern is, the red flag is, when you hit the high season, that's going to accelerate exponentially. So what the Director General has done is has issued some temporary recommendations to get the world in front of this by vaccinating every traveler out of those areas to try and stop the spread. And that's what she promised the Executive Board of this Assembly back in January, and that's what she told them today she had done. An extraordinary step to help finish an extraordinary goal.
Super. Alan, let me turn to you at this point. One of the key factors in this last mile that we are in for eradicating polio is going to be introducing what is known as the inactivated polio vaccine. I'm going to leave it to you to explain this to our viewers. What is IPV? How does it differ from what we're using in many places today?
Absolutely. So I'm with the Gavi Alliance, and we're a partnership. We're a group of organizations, WHO, UNICEF, the World Bank, Bill and Melinda Gates Foundation, a number of others, private sectors, et cetera, coming together towards a shared set of objectives to try and save children's lives and protect people's health through vaccination. And in doing that, having worked for, although relatively young compared to the polio effort, only since 2000, we've done really some amazing strides. So more than 440 million children have been immunized, more than 6 million future deaths averted. That's a pretty impressive track record.
Yep.
It really is, and that's one of the beauties that we were able then to bring to the table to complement this incredibly ambitious and incredibly important undertaking, which is eradicating polio. Gavi has been working to both strengthen the immunization programs and introduce new vaccines throughout that period of time. And that's where I think our shared alignment, our shared complementarity really is coming to the fore now. We both need to do those things, strengthen the basic primary healthcare services, the immunizations that need to be, the services that can deliver immunizations day in, day out, and bring a new vaccine like inactivated polio vaccine to the table. Now, kids need to have polio vaccination in order to prevent the disease, absolutely. An oral polio vaccine has gotten us really most of the way there. It's been an incredibly, incredibly powerful tool. And in order for us to get to that last step, we want to have an additional level of protection. We want to bring an additional vaccine into the equation at this unprecedented time, just as we're near the push, which is an activated polio vaccine. It will help both strengthen the immunity of kids and also give us some insurance, let's say, as we begin to transition away from the oral polio vaccine as in these last steps of the end game.
You touched on something there that I want to follow on for just a second, because I think it's very important, especially in what we're doing here this week. The benefit broader in health, once you get a good immunization program established there. Talk about that. How does that give you additional benefit in health if you can get a strong immunization program in place?
If you think about the people that are here today, the ministers, they're politicians, but they're more driven by what they want to deliver to their people. They want to bring health services. And that means reliably, systematically ensuring that people, whether children or older otherwise, are able to receive the benefits of basic healthcare services or otherwise. And in this case, immunization is an intervention. It's a package of preventive tools that are reaching more than 4 out of 5 kids around the world. Now, less in the poorest countries, which is where Gavi works, the poorest 73 of the world. But still, it's probably the vaccine or the intervention that's reached more widely, more kids in the furthest places. And that's part of what the Polio Initiative has taught us, is how do you even reach those last children? But when you reach a child, when you reach a person, what do you want to do? Do you bring them just a vaccine? No, you really want to help teach the parents about the development of the child, talk about nutrition, talk about other antenatal care to help with decreasing the number of children in a family, deworming activities, and all of these things. And this is why, when these ministers are here thinking about vaccination, they're thinking actually about a platform, a way to reach the children of their country more regularly, more systematically, more routinely, day in, day out, than probably any other intervention today. And that's the platform that I think immunization has to offer.
Super, thank you so much for that, Alan. Bruce, I have one last question for you. The international health regulations have been a theme that we've been talking about today because it's been the biggest theme here so far with the technical briefing that was going on. Obviously, it's been very engaged with polio at the moment. How is the international health regulations going to help you meet your goal for polio?
Well, the international health regulations aren't going to help just me, Christy. They're going to help the world achieve its goal. Let's be really clear. Polio eradication can't happen unless everybody is involved, unless everybody understands how important this is. And what the international health regulations are doing is they recognize that there's two keys to finishing the job. One is to finish eradication in the last infected area. So children are being paralyzed in Pakistan. We've got to get those kids vaccinated. Kids are being paralyzed in parts of Nigeria. We've got to get them vaccinated and get the job finished. And those governments are committed, they'll do that. But the other problem is the virus is moving from those places to find children in areas that have long been polio free. And what the international health regulations allow countries to do is to stop that international spread. That's what they're designed for. They're not designed for helping Pakistan finish its own problem. That's Pakistan will do that. But what they will do is help the world, help prevent the rest of the world from getting infected while they get it done. It is a great tool, it is a great treaty that allows the world to collectively prevent the international spread of diseases. And when you're trying to eradicate a disease, and one of the last things you're doing is being distracted by international spread and is putting the whole initiative at risk, you need a tool like this to help get the job finished. It's the perfect tool at the perfect time to get a perfect program finished.
Thank you both very much for your time. I appreciate your willingness to swing by in a busy time and update us on the latest, so thank you very much.
Thank you.
So there you go, two people very dedicated to wiping polio from the face of the earth. And you're seeing another theme here as we're working our way through this hour, and that is that so much of improving the health of people around the world really relies on partnerships. Every single one of these panels has been talking about what they've done together with partners in order to improve health. Something like the health problems that we face today really are too much for one organization to do, but they really make a great project for partners everywhere. That's all we have time for today. I want to thank you for joining us for Global Health plus Social Good. Tomorrow is probably going to be one of the biggest days here at the World Health Assembly. The question that came in about the future of public-private partnerships in WHO is actually something that you'll hear a little bit more on tomorrow. Committee A will start with an update on reform. One of the biggest issues that they're going to be looking at tomorrow is how WHO works with non-state actors. And when we say non-state actors, we mean people who are not countries, other organizations, civil society, private sector. This is new ground for us. We don't do this very much. And if you look at WHO today, less than 1% of our funding comes from the private sector, and much of that is actually in-kind contributions with medicines and equipment and things like that. But we realize now the way that the health trends are changing, that we really are going to have the help of private sector in some areas. This is tricky for WHO because we do norms, standards, and guidelines, and you don't want any undue influence in that type of work. We don't want any undue influence with policy, but we also recognize that there is a lot that private sector brings to the table. And what they're going to be talking about tomorrow in Committee A is how do we find that balance? Gowden Silversmith, who was here at the beginning of the hour, is the one from WHO who's leading that process through. So he'll come back at the end of the week and update us on that. We also have 2 guest speakers who will be talking tomorrow about 2:30 in the afternoon. Melinda Gates, the co-chair of the Bill and Melinda Gates Foundation, will be here, as will Dr. Christine Kasabasata, the First Lady of Zambia and WHO's Goodwill Ambassador on Gender-Based Violence. That's all we have time for today. Thank you for joining us. Please keep tabs on what's going on here at the World Health Assembly in Geneva on our social media platforms. Thank you.